everyone. My name is Fabiola Lopez, Regional Organizing Director with Planned Parenthood of Greater Washington and North Idaho. Because you are a strong supporter of your local Planned Parenthood, you received a letter from our CEO, Carl Eastland, last week. In that letter, he shared about how we will build a bold future based on providing and protecting access to abortion, delivering more care at our health centers, and pursuing health equity in our communities. You make this work possible, so we are asking for your generous support and wanted to share some more details about the services and programs that cannot happen without you. As you consider a gift of support to Planned Parenthood in your community today, I wanted to remind you that your investment will go twice as far thanks to a match opportunity from the Star family. Each donation will be matched dollar for dollar up to $30,000. And now I would like to introduce to you our CEO and President, Carl Eastland, to share with you how your continued support will make a difference.
Hi there, my name is Carl Eastland, and I'm the CEO of Planned Parenthood of Greater Washington and North Idaho. Thank you for joining us for this brief video presentation. First of all, thank you so much for your support. We couldn't do our work without it. This pandemic has been very, very difficult for our patients and our staff, but we have been busy preserving family planning and abortion access throughout our region. We continue to offer visits in our clinics, through video visits, and also over the phone for patients who do not have access to technology. We've also used this as an opportunity to expand the work that we do to make our community stronger. We continue to expand our behavioral health primary care programs. We've also opened a new clinic in one of the areas of our region that has the least amount of access to services. We're very proud of this new clinic in Moses Lake, and we hope you get a chance to visit it and help support that work. Lastly, I want to ask you a favor. Please be on the lookout for information about Title X. Title X is a federal law that was enacted in 1970 designed to help make sure all women had access to birth control. The Trump administration decimated this law, and thankfully the Biden administration is reviving it and trying to make it better than ever. So please, if you're able to make comments to help support this important work, we would greatly appreciate it. Again, thank you so much for your support. We couldn't do our work without it.
Thank you, Carl. And now I would like to introduce to you Cindy Aceves, our Chief Operating Officer at Planned Parenthood of Greater Washington and North Idaho. Cindy leads our health center initiatives and operations. Her team provides direct patient care to over 35,000 patients each year. Cindy will share more about how we are pursuing health equity, specifically through our mobile health clinics in rural farm-working communities throughout our service region.
Thank you, Fabiola. Hi, my name is Cindy Aceves, and I'm the Chief Operating Officer at Planned Parenthood of Greater Washington and North Idaho. I've been with this awesome organization for over 17 years, and I am so proud of the work that we do and so grateful to you for making the services and programs at Planned Parenthood possible. In our pursuit of health equity, Planned Parenthood is doing everything we can to bridge the gap between people and essential care. Our values, mission, and input from our community members led us to begin a mobile health clinic initiative. We believe at the most basic level that health is the essential foundation for individuals, families, and communities need to thrive. Our region will be a better, healthier place when everyone's basic humanity is recognized and prioritized. A significant amount of our state's essential agricultural workforce live in medically underserved communities right here in our service area. These conditions are compounded by a lack of access to information in their native languages, healthcare coverage, and reliable transportation. As a critical safety net provider, we felt a responsibility to our patients and communities to do our part in breaking down these barriers through both direct services and as a central part of our advocacy work. Removing barriers to time-sensitive care is imperative because so many families are unable to access even basic preventative health services. Through the Mobile Health Clinic initiative, we are able to offer a wide range of free health services including COVID-19 vaccination and testing, reproductive health, and primary care services. Each mobile clinic is equipped with Spanish language educational information and bilingual volunteers and staff. We collaborate with local community partners in providing key information around civil and immigrant rights, as well as food assistance. This service delivery model, piloted in 2020, was effective in providing time-sensitive, whole-person, culturally competent care by meeting people where they are at and removing barriers to their essential needs. Please donate today so we can continue to expand our reach to local rural communities in 2021. Thank you to all of our staff, donors, and supporters who continue to show up for our communities. Together, we will boldly pursue a future in which access to quality healthcare is readily available no matter who you are or where you live. Please consider a donation today to ensure that we can continue this work in 2021 and beyond. Thank you again for your support.
Thank you, Cindy. Please look for our letter if you have not read it yet, and send in your donation today by going online to ppguiney.org or by mailing in your remit envelope. Thank you.